All right, so we will open the May 1st meeting at 5:02. And welcome, everyone. The first item on the agenda is reviewing the minutes from last meeting. I did review them and didn't see anything that needed correcting. Did anyone else have any?
I think my only comment is it looks like it was a good discussion, and I agree with all of the conclusions.
And I realized that I was supposed to say who's here for the public record. So from the board, we have myself, Risha Hess, Pramila, Betsy, and Jack. From the health department, we have Kiko, Maheen, and Susan. So sorry about that. Okay, so does anyone want to move to accept the minutes if there's no comments?
I'll move to accept the minutes.
Okay, and a second.
I'll second.
All those in favor? Great. All right. So the next part of the agenda is public comment. And so usually the way we do this is if you would like to be promoted to be able to speak, raise your virtual hand through Zoom and we will promote you.
So I see 5 people in the waiting room. I think most of them are associated with the agenda item about the Fort River geothermal well. But if any of you are here for other reasons and you want to make public comment, please do raise your virtual hand and we'll unmute you so you can make your comment. If I don't see a hand, then we won't unmute you. Okay.
So we'll go on to the next agenda item, moving right along. So it's the old business, and what we have here is the body art regulations. And so Kiko, I assume that you have an update on whether or not we have to have a public hearing or if it's all fine. And given the title, I'm assuming it's all fine and we just need to set an effective date.
Yeah, we don't need to hold a public hearing. We do need to put a little announcement in the Gazette when the regulations are signed and effective. So Nancy will do that. She's going to put in something that will say that both tobacco and body art are effective or revised and updated and effective so that we can save a little money because those ads are expensive. So that's all done. I think there are just 2 things to talk about with respect to the body art regulations. One is to set an effective date, as it says in the agenda. And the other is that and Susan, it's great that you're here. You're here mostly for the geothermal item, but I think that you can also weigh in on this one, which is that I did show the regulations to Susan, and it was so helpful to have her input before, which was really what drove the revision, the most recent revision, her experience of having put them into practice. And so she suggested that we add a little bit of clarifying language, which we don't need to take to a vote. It's just something to make the things seem a little bit more clear, which is just when it comes to the training in Annex A, where we list the trainings, to put in a disclaimer of some type, which is that essentially that the Board of Health doesn't recommend a specific one of the organizations and doesn't preclude other organizations not on the list that meet the specified requirements from being a training that somebody could take. So that's just something that's normally put in when there are other required trainings, say for food certification. If there's a whole list, there's usually a disclaimer that says, here's the list, but we don't endorse any particular one, or there might be others out there that meet the requirements. So, and also just to say that the list is updated on a certain time and it's subject to change. So to go back and update it or check it periodically. So that was one disclaimer that she recommended. And then the other disclaimer in Annex B was to add a statement that says, comments by the apprentice and the trainer should indicate how progress is being made to complete the training period requirements as described in the regulations, so that you can ensure that the person is just not just sitting there, but is actually doing stuff during the time that they are in their apprenticeship. So just a little bit more detail about that. Again, these are just clarifying statements we can add to the 2 annexes. And Susan, did I capture that? Anything you want to add as long as we have you?
No, I thought you made that very clear. Thank you.
Well, I think that's great news that there weren't more because you're the ones who are clear on where we have gaps in our regulations. So thank you for reviewing those.
Well,
And those,
thank you and both for all the work you put into this because it's greatly appreciated and I think it really will make a difference as we review applications.
great. So I
Um,
don't have the same concerns about delaying an effective date on these as I did with tobacco. In that I think this is more demand driven from it helps the one business that it applies to in town rather than, you know, requires them to prepare something and change a policy. So are we able to do it sooner? What's the
Yeah, definitely sooner. No need to wait 3 months, as you said. No products have to come off the shelves or anything like that, as with the tobacco regulations. So it could be effective immediately or effective, June 1st, or, yeah, I don't think it really matters that much. I don't know, Susan, do you have a second thought about that?
No, I think to make them effective in 1 month will allow people a moment to take a breath about it, but I don't see any reason to really delay.
okay? So shall we say effective June 1st? I assume we have to have a vote on that.
Yes.
Moved.
Okay,
Seconded.
thank you, Pramila. All those in favor of June 1st? Great.
And then just one last thing, Risha, before you all move on to new business, which is that both the body art regulations and the tobacco regulations need actual physical signatures from all of you. I think what we've done in the past is that we've made home visits, with the hard copies so you can sign them. So we're happy to do that if it's easier on folks, or if people want to come here to the office, that's also an option. Just wondering what people's preferences would be. I think the sooner, we're actually getting requests, especially for the tobacco regulations. People do want to see the executed copies. So it'd be good to get this done soon. So what are people's preferences?
I can stop by, but I live close by, so.
Okay, that's great, Pamela. And if
I can stop by, but if you're going to see Risha, we're a twofer.
That's right.
I could come by on Tuesday afternoon. If we want something that's before 4 p.m., then you might have to come to me.
That's that's fine. If you, okay, so Pamela, when would you be able to come by?
I could do it as soon as tomorrow. As long as you say, the hour, I'm assuming 9 to 4 or.
Yeah,
somewhere in
9
the-
to
yeah,
9 to 4.
okay.
Yep, yeah. Okay, that's great. So, and that works, Risha, for you to come on Tuesday after 4, basically, is
And
what you're
it'll be
saying?
about like 4:05 or something.
Yeah, I'm always here after 4, so that's not a problem. And I don't know, Jack, about you. Betsy, what about you and Jack?
I'll do it either Friday or I'll do it on Friday, probably around 9.
Excellent. Okay. Friday, like tomorrow?
Mhm.
Okay, okay, great.
Yes.
Yeah, and just I could just come in sometime tomorrow too.
Oh, great.
Do you need a time?
No, I'm gonna be here all day tomorrow. I have a
Okay.
little meeting from 9 to 10. So Betsy, just so you know, I'm actually facilitating a Zoom meeting from 9 to 10, so I wouldn't be so available. And Maheen's
Okay.
not here in the office tomorrow. So anytime after 10 tomorrow is better for me, if possible.
All right.
I might do it then on Monday morning because I always feel like I'm gonna try and get out early in the morning. But it'll be sometime on Friday or else first thing in the morning Monday.
Okay, excellent. Okay, good. Thank
Can
you,
I ask,
everybody.
we don't have Dia sign them because she's not here now, even though she was part of the
Yeah, I did ask Angela Mills, the assistant to the town manager, that question. She said no, she wouldn't sign them since she's no longer on the board, so.
Great. Anything else on old business before we move on?
I think that's it.
Okay. Well, our first up for new business is the Fort River geothermal well application, and I think that's everyone who's here. So I don't know if it's Kiko or Susan, over to one of you.
Yeah, Susan, do you want to give an intro?
Sure, so you have the attachments. I'll just briefly refer to the geothermal well application summary for Board of Health review. It starts with the pertinent information. This is property owned by the town of Amherst that we usually refer to as the Fort River project. It is well application number well-25-1. We have the applicant, Nick, I believe, is here. The project manager is James, and the well driller name and registration number is provided. The attachment includes several pages of the site plan for review. And there's one plan review, and it shows the field where, and there's quite a few boreholes, 84 holes altogether. So it's a large project. I provided a number of maps to give you different flavors, but I did go out to visit the site, did not observe any issues that would be objectionable. I also included comments by the wetlands administrator, Aaron Jacques, who set some conditions, mostly having to do with the dewatering. So the one concern I think that Aaron had was that if the water that is pulled from the ground, that's where she refers to dewatering, discharge, sedimentation. The project managers proposed that there would be basins on site, so the water would be returned on site for the water storage of these of the water pulled from the ground. And Aaron wanted to be sure that if this water storage on site exceeded capacity, that at that point, a frac tank system would be set up on site to remove excess water. Aaron had noted to me that it's common to have this frac tank on site, and in previous projects such as Amherst College, they did provide trucks with tanks to remove this water. So as long as this requirement is on site, Aaron was comfortable signing off on this step of the plan. But she does note that there are still conditions to be satisfied with the orders of condition from her department. So generally, she doesn't go into a great deal about that, but she does meet back with the project manager to make sure and does an on-site inspection to ensure that those orders are met. So I think we are at this point, as far as I can see, that it is ready, the application is ready for approval by the board.
And Susan, do you know if Jared or Melanie or Nick want to make any comments, or does the board have any questions? I can promote folks to panelists if they want to be able to have a conversation with the Board of Health about this application.
I think they wanted to be able to attend and hear the meeting and be available, but they didn't specify that they wanted to speak at the meeting.
Okay, So then I would ask then if the board members have any questions, Jack in particular, and then folks in the waiting room, if you do want to say something, please just raise your hand and we can unmute you or promote you into the meeting. So. So for board members who reviewed the application, you heard what Susan had to say. Seems fairly straightforward. Are there any questions, comments, concerns?
Okay, so they're not gonna present anything other than the paper. Okay.
I don't think so. I mean, there certainly, if you have questions, Jack, certainly ask them and we can have them be part of the
Well,
conversation.
You know my general feeling about the geothermal wells, but I don't feel like we got a lot of details here. But again, I feel like this is already, adequately regulated with the other town committees and boards and staff, Aaron Jacques and all that. I'm just bringing some of the things up. So rather than keep
go ahead.
everybody waiting, I don't know what to say. I mean, I don't imagine there's nothing that really red flags for me on the project. But I think the last geothermal project we had more of a presentation.
Yeah. So Susan, should we call on would it be Nick to say a few words? Just,
Nick is the applicant, yes.
okay. So Nick, I'm gonna unmute you. I'm actually gonna promote you to panelist so you can join us. And you should appear.
I would just comment to Jack and say that, when we don't have a lot of detail, we don't request very much information on the application. So when you look at this summary, I've collected all of the information that we request of them at the time of the application. So they did comply with all of that was requested of them.
Okay.
Can everybody hear me?
Yep.
Hi.
We can hear you and see you. I also did promote Melanie as well, since Susan said that she's also representing the project. So go ahead.
All right. I'm actually on a plane right now, so it might be if Melanie can say a couple of things about the geothermal in general. I was at the project, and again, if you can't hear me, just promote Melanie. I was at the project site today. It looks really straightforward. Allied Geothermal has done over 8 million miles of geothermal drilling, and this is a relatively straightforward project. I don't see any concerns that would be an issue to the town at all. So any specific questions with regards to anything? Sorry, I didn't have anything prepared.
Yeah, I mean, I guess, I don't see this as in a particularly, sensitive area. I don't believe it's within an aquifer, setting. Do you know what the depth of bedrock is right there?
The depth of bedrock is on the test wall, I believe it was about 90 feet. We're going to be setting 6-inch steel casing in within 10 feet into the bedrock.
Okay.
Back up.
And is it till or sand and gravel? What is, I don't believe it's part of the town
It's,
aquifer, but again, I'm not sure that was requested, but
I had on the test well, we had sandy gravel up until there's somewhere between 90 and 100 feet. And then it was red that.
do we have a copy of that log?
So we do not, and maybe that would be a good thing. We did not receive an application for the test boreholes, and if we had, there would have followed with a well completion report. So I think that's what we're looking for here is a well completion report for the test wells, boreholes.
Yeah, I mean, I guess I just, and whether it's, within a wellhead contribution area, I don't think it is, but, it looks like on the surface, with regard to working with the Conservation Commission, that the drilling wastes and liquids are properly being handled. And Aaron is happy with that part of it. I guess that is, I don't know who, I mean, the town is, this is the town project, right?
It is.
Yeah, so.
Nick, would you please provide us with copies of the well completion reports for the test wells? And we will add it to your current application and not require you to generate a new application request.
I can include those. We didn't do the well complete, just so you know, we didn't do those test wells. They were completed by another drilling company. But we have it in our
Oh, thank you.
set of
I was
data.
not aware of that. Thank you. We'll follow up on that and see what information we can get. Thank you.
Yeah, we're more than happy. We have a copy of the drill log and the geothermal conductivity test report that we'd be more than happy to provide. But as far as the actual well completion, it would have to be from the local driller.
Who is that speaking?
This is Melanie Judd with Allied Drilling as well.
Oh, okay. All right.
My apologies.
Yeah, yeah. Sometimes the people are, even Susan, she's speaking and a prompt doesn't come up within the Hollywood squares here. I thought everybody, once somebody started speaking, that there would be like an icon or something.
Yeah, it's supposed to do that, but I don't know. It's been a while since I've been on a Zoom call too. We're
Yeah.
usually dealing with Google Meets or something along those lines.
Yeah. Well, Susan, I don't believe this is within an aquifer, a mapped aquifer area, the Fort River property.
Correct.
Okay. All right. So I would just say, I'm okay with voting on that, but if we just, have that sent along separately, that would be fine. But I don't think we need to impede the project, waiting for more information.
I agree.
Mm-hmm.
I just wanted to clarify, at least for me, Jack, I don't know about for you, but Susan and Melanie and Nick's cameras were not turned on, but when they're speaking, that their name is in a big black box on my screen. So maybe that's not showing up for you, but I'm able to see.
Okay,
So,
that's
yeah.
probably maybe it's a setting for me. I
Yeah,
don't know.
maybe, perhaps.
But
So
that's what I'm looking for, though.
yeah. But I also, so thank you for what you just said. And then I wanted to ask though, Susan, I see that Lois has raised her hand in the waiting room. I'm assuming Lois is part of this project. I'm not familiar with that name.
I'm not familiar with the name Lois.
So just because, in terms of taking comments, it would have to be related, we don't take public comment unless the person's been invited to the meeting, so I'm not really sure. I think I'm gonna, oops, maybe I can allow Lois to talk and then just figure out if she's somehow, do Nick or Melanie know who Lois is? Related to this project in any way?
I do not. I don't have a Lois on. Sorry, my phone cut out while I was on the plane. So
That's
Yeah,
okay.
no-
We've actually
no,
been
we're-
able to hear you fairly
Yeah,
well.
not
So,
aware of anybody by that name on our side either.
so Lois, if you can hear me, I just want to clarify that we are only, if you're somehow involved as a driller or person with this, professionally with this, if you have a concern about this project, that should have been public comment at the beginning. I don't believe we can take that public comment now. So we're only taking comments from people who are sort of part of this presentation, who are the folks who have spoken already. So in that case, I'm assuming that you would lower your hand, knowing that we can't take public comment from you about this project, if that's what your hand is raised for. And sorry, this is very awkward that I can't see you. I'm talking to basically just to open space, hoping that you're hearing me. But as far as I understand it, and please Risha or anybody else jump in, we don't know who Lois is. She doesn't seem to be affiliated with this project professionally, so I don't know that we can take a comment from her at this point. But I'm open to other thoughts if I'm misinformed.
My only thought is that sometimes people's usernames are not their names, and because they've logged on using someone else's account. So I would be open to hearing what the person has to say, and then if it is not or hearing whether the person is part of the team.
Okay.
If they are not, obviously we can't put their comment in record.
Okay, Lois, I'm going to allow you to talk.
Hey, this is Jack. Bob Parent just called, and that's his wife's name. So that's
Oh.
Bob Parent. Yeah.
Gotcha. Okay. So Bob Parent is with the town.
Yeah.
Thank you for that clarity.
Mhm.
You should be able to speak now.
Certainly. Can you hear me?
Yes.
Yep, I realized I'd have to log off and log back on to change the username, so I'm glad you let me in. For folks that don't know who I am, Bob Parent, I work for the town of Amherst. My title is Special Capital Projects Coordinator, which makes me the go-between between the town and the contractor and the designers on projects like the school project and other projects in town. So I can add a little bit more information if folks would like regarding this project. I know, Jack, you were asking about a well log. I don't have the geotech well log handy, but I do have test boring logs that were done by Seaboard on behalf of OTO. Just to give you a sense of what the soil types are, down good 60 plus feet, we're looking at silts and clays most of the depth. So it's pretty clear we're not in an aquifer area here. We're in a pretty dense area of poor soils, poor enough that as part of the original site preparation, the early site package, we had to go through a preloading process as well as a ground improvement process with rammed aggregate piers because of the poor soil conditions. So if that helps
Good.
a little bit,
Yeah.
Jack, in terms of understanding what we're dealing with.
That is perfect. Yes. I just hadn't seen the resource maps for that area, so I didn't know off the top of my head what we were looking at.
And I can
Thank
add
you.
just a little bit of more information to follow up on what Susan shared. Myself and Aaron have been working together very closely in this project because Aaron obviously has a major role as the Conservation Commission agent. I have a role as well in that I'm signatory to the Stormwater Pollution Prevention Plan on behalf of the town. So as a town representative, I'm certifying that the stormwater plan that the contractor CTA has put together complies with EPA requirements. So both Aaron and I looked at what was proposed very closely. And as recently as yesterday, we were interacting with the contractor relative to what they were planning to do with the dewatering water. And Aaron ultimately was very happy with what's being proposed. They're proposing completely separate detention locations for the dewatering water from the site stormwater. And they are proposing not to have any of that dewatering water leave the site. They believe they can infiltrate it all onto the site after it's detained.
That's always good. Yeah.
Thank
Yeah.
you.
So yeah, thanks. So I don't have any other questions or concerns.
I don't either, and I'm assuming Pramila and Betsy, who have not gotten off mute, do either. So shall we take a vote? And what is the, I always get confused on what are we actually approving? Just the application, or is there something more specific?
This is a well construction permit. You are approving the well construction permit for application well-25-1.
So moved.
Yes. I second.
Great. And so all those in favor? All right. Glad to see the project progressing.
Thank you.
Yeah.
Okay, great. Thank you. And thank you to Nick and Melanie and Bob for joining.
I think that's our first participant calling in from a plane, is making us all look bad.
Yeah.
All right, so the next agenda item is planning future Board of Health work and priorities. And I know Kiko had given this some thought, so I'm going to hand it back over to you.
Yeah, so I think a couple of meetings ago, we had talked about what sort of work the Board of Health would like to do in the future. And we have spent a lot of time, as Pramila and I discussed when we saw each other last week, on these body art and tobacco regulations, more time, I think, than any of us sort of anticipated. But I think that we've come to some good places and created good regulations the board has. So it's good work that's been done. I know that there is a commitment to revisit this nicotine-free generation provision sometime later on, where we could do a really good job of getting more input from the Amherst community on that particular issue. So that's a little bit on hold for the moment. But I think some of the other things that we've talked about, and it's relevant, I think, to the last agenda item, which you made reference to, Jack, is just the whole geothermal permitting application coming before the board, and whether that makes sense. I mean, just really thinking about the well regulations in general that are currently within the Board of Health's purview, that could be shifted, changed, redeveloped. So that's one thing that we had talked about. That's something that is really more within Jack's expertise than anybody else's. It might not be something that makes sense for this whole group to work on, through a series of board meetings as we have with the other regulations. But it is something I think that the board could decide they want to do differently. Maybe it doesn't make sense to do it the way we're doing it right now. So that's one discussion point. Another thing that we brought up sort of in passing was just the issue of fluoridation, which we know is very much of a political and a hot topic right now. And I, again, don't know whether it makes sense. I think one thing we talked about, the group had talked about, was being proactive about some health issues. Not sure if fluoridation is one of those. Currently, the water is fluoridated in Amherst. There's certainly a move nationwide to stop fluoridating water. State of Utah has stopped doing that. Other towns across the country have stopped doing it. And it's a sort of nuanced issue, but I think the data are, from a public health standpoint, pretty clear that fluoride at low levels does not present a risk and does promote fewer cavities. So anyway, that's something that I think could be fraught. Maybe we don't want to talk about that. It's a question to the board. But that was something that had come up in the past. The other sort of ideas that I had was just thinking back to other things people had talked about or before that. Wastewater surveillance we do for COVID, and it's been really, really helpful to have that. We know we get actually quite a bit of feedback from the community about how helpful it is to have information about COVID levels in our wastewater. And there are other things that UMass Amherst is looking at in wastewater. There could conceivably be partnerships, projects between the Board of Health, Public Health Department, UMass around different other things that we could look at in wastewater surveillance. Just a thought, just an idea for the board to kind of, think about. And then so those are kind of, the first two things are definitely policy things, and the Board of Health is really a policy-making body. So thinking about well regulations, thinking about fluoridation, those are squarely within the board's purview. I think wastewater surveillance, I'm not sure what kind of policy the board could make around that, but there might be something. And then there are other sort of programmatic things. Betsy, I remember that you had mentioned when you first started the idea of having more defibrillators around, especially in certain places, like I think playing fields was one that you had suggested.
Yeah.
Daya, when she was here, had talked about, mental health programming. I don't know if there could be policies related to these program areas. Perhaps there are. So those are kind of the things that I was thinking about, but I really feel like it's up to these folks, and we are missing a member. So we do have a vacant slot, which I hope will be filled in the coming months. It's really up to the town manager's office to do that. But to come up with maybe a prioritized list of things that the board can be proactive about, that we think are really critical to the health of the Amherst community, while still reserving some time to be reactive, because sometimes we do have to be reactive to things that come our way. But how can the board be proactive about some of these health issues and kind of build on the experience that we've had together around some of these regulations that might need some to be thought about differently from the Board of Health's perspective. So those are my initial thoughts.
Can I make a comment?
Please.
So I'm hoping we don't have to go into fluoride, but I'm curious about whether anyone has lobbied the health department to relook at our fluoridation.
Since I've been here, I think I've received a couple of emails, phone calls, so maybe 2 in the last year and a half from people who were considering or were requesting that the Board of Health look at that issue.
But there hasn't been any in the current political moment, which is question fluoride.
I have not heard from anybody recently, no.
I think my own personal sense is to not go there then, to not go there unless there was a public swell of interest in the issue.
Mm-hmm.
I do have a couple of things on the wastewater surveillance. I know I found it very interesting, and I suspect others did, to hear that, high levels of flu were circulating in the wastewater when that was happening. And I wonder whether things like flu, RSV, and COVID that do have some diagnostic and therapeutic action attached to the surveillance data, that, just monitoring that is a helpful thing, and then connecting with local medical providers if that's showing interesting things or publicizing that data. Another issue that I thought beyond the defibrillator issue, which I still think is a really important one, making sure that children's sports, teen sports, that coaches have been trained for using defibrillators, and they're available to sports teams. I think I don't know what the policies are on that, but I do think that's a very useful thing. And I also think it's such a, looking at the whole issue of the town pond that's probably not going to open again this summer because of water contamination. I think there's a lot of interest. You know, it is a health and well-being issue. And, you know, I wonder whether an understanding of what's going on there, and is there anything that can be done to, I'm blanking on the name now.
Puffer's Pond.
Puffer's Pond. I think there's a lot of people very interested in Puffer's Pond, a lot of sadness about the amount of closure there. And when I interviewed with the town manager, I asked him about it, and he was telling me that basically he thinks that there's just a lot of very marginal septic systems that drain into it, and he didn't think it was going to be something that was solvable. But I do think there's a public interest as a health and recreation issue, and I wonder whether we want to at least be part of that discussion as a proactive, positive issue.
So with regard to Puffer's Pond, I guarantee you that there are many eager students and graduate students at UMass that would love to be able to research a little bit with regard to the surface water, groundwater interaction around Puffer's Pond. And there may be a little bit of that going on right now by one of the faculty there, or the state geologists who I'm on the Water Supply Protection Committee with, Brian Yellen. But I, you know, I could probably even help kind of steward something if we want to take a closer look at that, along with the well regulations.
Yeah.
I should have a little bit more time moving forward. So,
do others agree that this is something there's a lot of community interest in?
Yeah,
I think
yes,
so.
I do, definitely. I've had
Yeah.
a lot of people ask what's going on. It comes up at the beginning of every summer, and it really would be a good idea to explore it as opposed to, you know, throwing our hands up. So I think it would be very meaningful to the community.
mhm.
The other, oh, sorry, go ahead, Risha.
Well, my thought process on this is, what role can the board play? Because I don't know what to call it, it's not a mandate, but it's very much to revise, so create new regulations, review existing regulations, and determine variance requests. So I can't figure out on some of these topics, and Puffer specifically, what that might look like from our end. It feels like it might be more of a Department of Health issue rather than a Board of Health issue.
Is it that is there any complexity about whether it's correct that Puffers should be closed for the reasons it's being closed? Is there an agreement that actually it really shouldn't be used for swimming?
Yeah, so I can jump in a little bit here. So yeah, there's no question that when the standards are very clear and set by the state, that when the E. coli is over a certain level, that the pond it's not safe for swimming. And so there's no quarrel about that. And we do a really good job testing, and we are in conversation with the state. There's a portal that we upload all the information to. So that part is clear. What's tricky is trying to figure out what's driving this. There are a lot of reasons, and there have been actually quite a few conversations about this. And as Jack said, Brian Yellen is somebody who is working with students and other people on general water quality issues in the Fort River watershed and other streams that fill swimming holes in the area. So there is an effort being made to look at sources. Sometimes when water sources are downstream from farms where there are heavy concentration of cattle, that can be a way bacteria get introduced into the stream. So there's stuff, people are looking at that. Another source, though, which I think is relevant to the Board of Health's purview, as you pointed out, Risha, is so aging sewers and sewage overflows can also be a problem. And when people put the wrong things down the drain, like fog, fats, oils, and greases, and wipes, whenever we have a sewage overflow, those are the culprits. Wipes that are not really disposable, even though they say they are on the package, and fog, fats, oils, and greases. So a lot of people may not be aware that when you can't put olive oil down your drain, even though it's liquid, when it's in the drain and it's cold under the ground, it congeals, and that can cause sewage overflows that can leak nasty stuff into the water, into, you know, the watershed. So this town doesn't have a fog ordinance. Some towns do. This is something that Susan and I have talked about. It is something that the Board of Health could implement. And it would be sort of a very upstream, unintended, way to address the Puffer's Pond issue. It wouldn't be everything, but it's a possible contributor to the poor water quality in Puffers. And it's a small thing. It wouldn't fix the problem, but it's related to the problem.
And I did notice that I was comparing what, for instance, Northampton has as regulations versus what Amherst had, and that's one of the ones that jumped out at me, that Northampton has a policy on that and we don't.
So
And
I'm
I
just,
think oh, sorry, go ahead, Jack.
well, I'm just saying, I've been on a couple of things. I don't know what the difference are, but you know, you have task forces, which is sanctioned by the town, you know, working groups, but there could be a, you know, a subcommittee that puts some energy into getting Puffer's Pond to something that can be, you know, utilized and enjoyed for all its intended purposes. And yeah, I think that would be something that the Board of Health could, you know, forge ahead on and perhaps lead.
And the notion, I guess there isn't a regulation, and I appreciate Risha that you have this expertise about following a charter and sticking to the mission of the organization. But I think when we think about health broadly, having safe recreation, you know, fits people's intuitive sense of what health is and what the health of the community is.
Yeah, and also from a climate change standpoint, you know, cooling centers are very important, and freshwater holes, you know, outdoor swimming spaces where people can go to cool off. That's a very real public health concern, not having those places.
Yeah, and I don't mean to insinuate that it's not a public health concern. I'm just trying to delineate what falls within the remit of the board versus the KICO's Department of Health, because they are more the implementation, and this feels more like an implementation. But I see some opportunities here to think about how to integrate policy into a solution.
Yeah, I appreciate you bringing that up because I think that's a constant tension. Is just, you know, what things fall into which purview, policy or program? Is it Board of Health? Is it public program? Is it Public Health Department? And I think that this is something that has pieces of it that could fall into both spots. So
I also know that something we've done in the past is sent sort of letters of support or letters of, I mean, we could make a statement that we think this is an important thing for the town to address from a health standpoint, but we wouldn't be able to actually do anything beyond that unless they put together a task force and asked for participation in that. To my understanding, I am certainly not the expert on how the town works, but that's my understanding.
Speaking of a letter and environmental health, I also would like to see follow up about the waste hauler proposal. I know the board wrote, when Nancy was the board chair, wrote a letter, I think at least a year after the proposal was accepted, and it's still lost somewhere in committee or something. I mean, this relates because um, uh, trash haulers would then all, it would have a competitive bidding process and I'm oversimplifying. You would have to look at the proposal, but the piece that's important to me is that they would have compost pickup for all households. So, I would like to see follow-up on that, at least to know where we are on the issue.
So Pramila, I think where we are on that issue is that I've been told that it's going to come back up, that there has been this conversation about whether the town is going to contract with a company that would allow that composting piece. You're right, the Board of Health did have something which predates me that I should go back and look at, that sort of, wrote some regulations about this, but I think there hasn't yet been the ability to implement them. So that's something to look back on. As I said, I'm being told that it will be coming up again soon, this issue, but I haven't heard anything recently.
Yeah, I think maybe an update would be helpful.
Yeah.
It's just
Yep.
it's been in process for quite a long time now.
Yes, it has. Yeah.
I have one other question that that is it's a bit of a half-baked question, but it's whether or not there are any concerns about immunization requirements in public schools being weakened. And whether that's something that will be handled at a state level, and we have a very good state system, so we may not be impacted by, but whether this is something that you're expecting to become controversial in the current moment.
So as far as I know, I don't expect that to become controversial in Massachusetts. I heard from the health commissioner, Robbie Goldstein, at a meeting I was at a little while ago that, we have high rates of vaccination in Massachusetts. Most people in Massachusetts are inclined to vaccinate their children. There are pockets, especially in the western part of the state, where folks are less likely to vaccinate. But we have a really good infrastructure as well as funding. There's a pediatric vaccine trust. So if the federal money were to fall out from vaccines, I think I might have said this in our last meeting, but that the state could sort of fill in. And I think I also know that there is some legislation that's being introduced to do away with the religious exemption for vaccines and only allow medical exemptions for childhood vaccines, which I think is gaining momentum. I think that legislation has been introduced a couple of years in the past and didn't pass. But the person I know, Dr. John Snyder, who you may know, who's been working on that, he seems to feel like there's good momentum here in Massachusetts for something like that to pass. So what happens at the federal level is a big question mark. I think there's always the question about funding falling out for many public health things. I mean, I know our counterparts in Northampton have lost $1 million in funding as a result of federal cuts for their health department's work. We don't have that problem here. So far, we're able to get vaccine, and I think Massachusetts will be able to continue to get vaccine. But we don't know for certain. There are a lot of things that could happen that are out of our control.
Right. Well, one of the things that I see as the biggest risk to this is that the EPSDT, which are the regulations that undergird the Medicaid program, which covers about half of the children in the western part of the state. Well, it's not just the EPSDT. There's a requirement that insurance companies pay for all vaccination and preventive care that has been endorsed federally. And if that stops being an EPSDT requirement, or if it stops being an adoption of the Bright Futures recommendation, and insurance companies no longer reimburse for these parts of well child care or immunizations, I can imagine that cost could become a real issue for a lot of families. And I don't I don't know if that's a, you know, the sky is falling down thing to think about when the sky, if and when the sky falls down, or whether, you know, just kind of understanding what safety net there is out here for these programs. And
Yeah. It's just hard, so hard to know what's going to happen, because I think a
Yeah.
lot of things that were unexpected have happened, and nobody really predicted the degree of cuts that have happened to Health and Human Services. So it's a tough time. Like right now, we're okay, but I don't know what it will be like in 6 to 12 months. So, but I do feel confident that Massachusetts leadership is very public health oriented, very public health focused. We have money in the state, you know, it just, we need to take care of these issues on our own, even if the federal government is not providing the support they used to.
yeah.
So, you know, but
And- But you're getting good information that those funds will be there for you to feel pretty confident that the funding for vaccination will stay, even if those federal programs
yeah,
fall apart.
I do. I hope, I mean, that's what I'm hearing from the commissioner, right? He was very reassuring in his answer to my question. I do know that funding has fallen out for example, COVID vaccine. So, you know, we do our vaccine clinics in partnership with the public health, with Northampton through the Public Health Excellence Grant. That grant is still intact, but the vaccine is very expensive now. It's not subsidized by the state or the Fed. So Northampton has to find the money in their various funding streams to purchase it. And there used to be a federal stream that helped them. That federal stream is gone for COVID vaccine. So it's going to be tough. Organizing vaccine clinics in the fall, it's going to be different this fall. We don't have the resources that we had this last fall. That's because of what's happening at the federal level. And then I think what you're saying about Medicaid would be, if there were changes to Medicaid, that's going to affect children across the country. That's
Yeah.
going to be tough. So I hope that
But-
doesn't happen.
Yeah, but even beyond Medicaid, the whole Obamacare reforms that required insurances to cover everything that had the recommendation of,
Yeah.
you know, ugh,
I know. So, I mean, this is not, I don't know how this relates to a policy move that the board could make right now. I think it's going to be very important for Board of Health members to be informed of what's happening. And there may be something that the board would do in response to things happening at the federal level. I don't know. I think we have to be nimble and we have to be poised to sort of respond in a way that makes sense within your purview. But for now, we're just doing our best to keep everybody informed and stay on top of things. So, I don't know,
Pramila,
Risha, where you, go ahead.
I feel like Pramila might have tried to say something earlier about an idea.
Well, no,
then
this
cut off.
was about following up on the waste hauler proposal
Okay.
and to see where that is. I also wanted to say to add on to what Betsy was saying about immunizations. You know, I really feel like we and the department should pay attention to the needs of the more vulnerable of Amherst's population, who are probably laying really low because of immigration enforcement and so on. And you know, I really would like, I mean, this is probably more a department initiative, but happy to help in any way. I know Nancy, the previous chair again, had done a needs assessment in Amherst, but I'm not sure whether, you know, whether generally underrepresented populations were involved or not. I know, you know, probably requires some outreach, maybe work for interns and so on. I just wanted for us to be thinking about that.
Yeah, I had put on my list, you know, health equity, which is not a thing you can do, right? It's a very broad, but one of the ideas I had was maybe to more holistically sort of prepare ourselves as things come, is to try to do outreach to the various other boards that So, you know, we've got the Affordable Housing Trust, we have the Council on Aging, we have CRESS. You know, are there groups that we should be strategically building relationships with now so that they see us as an ally if things start getting worse, so that we can sort of work together to protect the health of folks. I'm not sure what that looks like. I just know I have never spoken. I served on the Affordable Housing Trust a few years ago, so I know them, but I've never personally spoken to any of these. There's not initiatives where like the chairs of all the boards get together, you know, quarterly or something. So maybe we need to be a little bit more proactive in doing that. I don't know. Is there a, Premal, you've been here longest. Is this
Yeah.
something that has happened strategically, or does it have, okay.
Not in my time on the board, so.
I mean, there's also the school committees, the elementary school buildings. You know, we certainly have had some conversations about indoor air quality at the school, at the middle school. So yeah, it feels like maybe we should try to be a little more outward focused as well as reactive if we don't have to be looking at policies for the next few months.
Do we have a sense of like what is the vulnerable population? How large is it? What are the unmet needs? What are the emerging challenges? How many unhoused children, elementary age children do we have in our community? How many, you know, kids have parents that have at-risk statuses? Do we know who
I
our
know
vulnerable populations are?
I know some of these, and I think it would be a triangulation of different data sources. So there is an estimate on the gaps in affordable housing. So that would be, you know, people who are on the edge of becoming houseless or leaving the area, et cetera. Then there's the schools have good records on who has school lunches or those kinds of things. And then of course the senior center has data on that. So I think Survival Center would have data on who comes for services. And that, you know, the language is spoken, and you know, they do a lot of work. I'm on their board. They do a lot of work with making sure that they both have language and then culturally relevant food. So they do have a really good sense of the proportions of different groups coming in. I'm sure CRESS and others would have data. So I think it would be a triangulation of a bunch of different sources, but we could get a reasonable estimate.
And Betsy, when you were talking about marginalized communities, were you talking about specifically with respect to vaccination or just more generally?
I just think like it seems like we're going to be heading in for a difficult time now for many of the families in the community who are the people at risk, and what are their risk factors? What are their resources? What's the health of our community? When you look really big picture, what are the biggest risks in our community? And I mean, that seems like, you know, in some ways, of course, it's a very big picture project, maybe far removed from the practicality of, you know, looking at specific regulations, but it fits an intuitive sense about, you know, what the mission of improving the health of the community, like just understanding who's at risk, what the risks are, what the resources are, where are the gaps.
Yeah, so just a couple things about that. The needs assessment, Premila, that you mentioned that was done by students that Nancy sort of championed. It's now a couple of years old. It did find some things, you know, that weren't maybe a surprise. You know, many Amherst residents struggle with food insecurity, housing security is a big issue, transportation is a challenge. It didn't really focus so much on the needs of families per se. It didn't have a lot of data about immigrant or refugee folks and what their issues, concerns might be. We are connected with, there's a group that meets monthly. The emergency shelter, family shelters have received a lot of refugees, especially from Haiti in the last couple of months. And so most of those folks have been connected to us for vaccines if their children needed vaccines to be enrolled in school. So Olivia, our public health nurse, is pretty well connected to, you know, some of those families actually found their ways to themselves. They found their way to us without even being referred to us. So I think we are doing a good job of at least people know that we're here to provide vaccines to folks who don't know where to get them otherwise. Childhood vaccines I'm talking about. So we have a little bit of a sense of what's out there, but I think there's a lot more that we could do. I also wanted to mention that we really have been champions of this Red Card campaign, which we have a big poster in our health department. There are posters all over the town hall. Maheen made a beautiful poster that's we put up everywhere, also at the Musante Clinic, which informs immigrants about their rights. You know, should ICE come knocking to your house, what you can and can't do. What you should do is like, don't open the door, slide the card underneath, because the card explains what your rights are, and also emphasizes that you know, town buildings, because Amherst is a sanctuary city, that town employees are not allowed to cooperate with ICE agents to enforce any kind of immigration, you know, any kind of immigration enforcement. So we wanted people to feel like town buildings are safe spaces. I think there's a lot of fear in the community. I hear from folks who work with largely immigrant communities that people don't want to leave their homes, and I understand that. But we also just want people to know if they need healthcare, they can come here. We're not collaborating with ICE. You know, we're to the best of our ability, we're trying to keep people safe to as much as we can and have them have access to resources. So that Red Card campaign got quite a lot of publicity. There was a news story that was done, and it's the cards are actually disappearing. We're having to print more of them. So I feel like we're at least doing something there, but you know, being able to help people with more things, challenges like housing and food. I mean, there are food resources, housing is a big issue. So all that to say, I think we have a sense and we're doing what we can for people who come to us, but there's obviously a lot more data we could gather about, you know, at-risk communities, and there's more that we probably could be doing with our limited capacity to reach people. So I don't know if this is something that you think we should try to gather more data on, maybe do a presentation to the board. I don't know what the board, to your earlier question, Risha, what would the Board of Health's role be with respect to this? Is it just understanding what's going on to your community, in your community, and going from there? It's going to be a big issue. I think that'll get worse from here, not better.
I mean, one way to think about this is I think I was looking for Northampton's Department of Public Health policies and found in Northampton and another state their health department strategic plan. And so one thing we could work on is having a strategic plan, and maybe part of the priority is a better sense of the need and the populations. You know, where I come from, we would think of this as, you know, the causes of morbidity and mortality. We don't have a huge amount of deaths here, so maybe morbidity is not the right qualifier, but what is taking people away from being able to be healthy in their lives? So, you know, what is causing that, and help focus the health department, because we probably can't do the things, but to provide, you know, that kind of support. It's not really our mandate, right? We don't, but if there's not regulations that need to be regulated, it feels like it might be. Anyway, I think maybe a strategic plan at a very, very light level. I don't mean a, you know, months long, you know, big endeavor, but to just sort of outline where we want to spend our time when things are not when we're not reacting to what's in front of us.
Yeah.
Did anyone else have any ideas I think we've all been taking notes. Did anyone else have any ideas of things that they wanted to spend time on that hasn't come up yet?
Yeah, I went for a walk yesterday and had not a number of ticks. I think there's 16 ticks.
Wow.
And I have had Lyme. I have chronic Lyme. So obviously that's a subject that is kind of near and dear to my heart. And this is just using the paths. I just walked down the KC trail and there's no grass. I mean, it's all just low-lying stuff. And yet, you know, it's awful. So anyway, I know I'm supposed to wear, you know, gaiters and the permit, whatever that chemical is.
Permethrin socks.
Yeah. So, but I know you talked about, you know, West Nile virus and things like that. So just continuing that kind of awareness. But it's again another limitation of using our all these abundant, you know, natural resources in town. We have just so many trails, great trails, and you get this limiting factor. It's sort of like a analogy to the Pepper's Pond thing, not being able to swim in it because of some quality issues. But
yeah, and I would add that vector mosquito-borne illnesses is one of those things that keeps sort of popping up in my sphere in terms of people having questions. And I tried to refer someone to your one pager from last year, Kiko. Unfortunately, I think the town of Amherst website is not accessible from overseas.
What?
I
Really?
was not able to get in, so I couldn't send the link, but
Oh, how
which was weird.
unfortunate.
It was the whole town. It's not the public health department. But yes, it's come up again on the parents groups. And so, I mean, I think the two things I hear the most conversation about from the parents is the school air quality, and which is that there was a mold issue at the middle school, or potential mold issue. And then the mosquito-borne.
Okay. So it's good to know what the things, oh, go ahead, Betsy, go ahead.
Is overdose and the you know, Narcan availability and Suboxone treatment in town? You know, I used to follow this very closely with the pediatric world. I don't know whether those services are widely enough available. Have you heard anything about that one way or another?
I think that UMass is doing a really good job getting Narcan out into the community. Tapestry comes into Amherst regularly. We do Narcan distribution here through the health department. I think we could be doing more. We just recently entered into an arrangement with Northampton and East Hampton to do have Tapestry do more work. So we're using some of our opioid settlement funds to increase the amount of Narcan education, harm reduction work that's going on in the community. So that's something that we are working on a little bit. And I'm actually hoping to get a student intern this summer who could do more assessment and more of a program plan related to the opioid crisis and how to mitigate that. So I feel in terms of Suboxone, I know some people do it, some people don't. What's happening in Amherst with relation to that, I don't know about treatment options. I know in other places it's available. I don't know so much about treatment here in Amherst, but in surrounding communities, it's available.
Is it available through the Musante Center?
I
Do you know?
do not know.
Do you not know?
That's a good
Yep.
question. I don't know. Yeah.
I
So
guess the only other thing I realized, there was a recent conversation amongst the parents on bathrooms in the high school were being closed because there was a lot of vaping going on, and the staff sort of couldn't make it to that corner where those bathrooms were, and so they just closed them, and then everyone had an uproar because bathrooms are closed, etc. But that to me says that there might be some vaping, you know, childhood teen vaping conversations that might be useful. Again, not we passed the regulations, there's no more regulations on it, but,
Yeah.
to put that in the mix.
Well, I think you've raised a lot of important public health topics. I like the idea of doing some kind of a strategic plan, but as you said, Risha, light, because you can spend months doing a strategic
Yeah.
plan. I don't want to do that. But I think some kind of a guiding framework with some thoughts about, what the primary health concerns are and what are there any policy angles that could help improve the health and well-being of people in Amherst. That's something that I think we could work on. So my thought is just to kind of digest this a little bit, and maybe Risha, you and I could talk more about what we want to do at the next meeting to drill down on any one of these things. But I did just want to ask about the well regulations. Is that something that people have an appetite for now, later, thoughts about it? Just because I feel like it continues to come up, there's geothermal and other well regulations, and how much time does the Board of Health want to spend on them, or do we want to change things up so that we are, viewing these things differently? And when would that be? So I'm just wondering what your thoughts are about that.
I honestly feel like I add no value at all in reviewing those things. So I would be, I'd be very happy not to be doing that. I just don't, it seems like a more technical expertise. And I'm very grateful that Jack has done that, but I think most of us are not adding much value to that.
Yeah, I mean, like I said, I think I'm going to be able to get to it versus several months ago, I wasn't able to. So we can start talking about that more in earnest and kind of streamline it a little bit to where we really are looking at health related issues when it comes to wells and drilling and things like that.
And not the engineering.
Right.
Exactly.
Mhm.
Yeah, that's so smart. So then, Jack, that's something that you and I could work on separately when you
Sure.
have time. And then we could work something up that would eventually come to the board just for everyone's weigh-in. I think people can have some opinion about it, even if they're not the experts. Oh, that makes sense. This is what we want to spend time on as a board. And then there can be a vote that's taken. So we
So,
could
yeah,
that can be an
100%.
ongoing thing. Okay, good.
Thanks for that, Jack. I think that's a huge value add.
No, I'm happy to do it, and just sorry I hadn't had time up to this point. So
No worries.
I mean, I think it's, decades in the making that people have been doing it this way. So if you're able to give it fresh eyes and make more sense, I think, that's not a delay of a year.
Mm-hmm.
Great. The next item is just to decide on our meeting schedule. I suspect this is about October, but maybe there's more. I don't know if that's Maheen that's leading that discussion or Kiko.
Yeah, I can. So originally we had planned to have the meeting on October 2nd, but we didn't realize that that's a holiday. So we can either do the 9th or the 16th. So I know Jack said he might have a meeting on the 9th.
I'm an alternate, so this is more important. So
Okay.
it looks like that's going to be more favorable for most everyone. So I'll definitely be able to wing it.
Okay, so
Right.
I
Is
guess
someone not available on the 16th?
Yes.
I'm not available.
Okay.
Are we wedded to the Thursday?
I think for continuity's sake, it's better just to keep it on the Thursday. We've done that before where we've had to switch from the first to the second if there was a conflict. And I really apologize for overlooking the Jewish holidays. That is a big faux pas on our part. Sorry.
It's not a big deal for me personally. Calendaring is so complicated.
It's tricky, but we do have a list of all the holidays, so we need to pay attention to that when we're setting meeting dates. But so it did seem like the 9th would be better for everybody because at least one person, I guess it was just Pramila, I thought maybe it was somebody else too, couldn't do the 16th. So thanks, Jack, for being available. I think that seems like the better way to go. Yeah.
Sure.
And Okay, and in general, so Maheen and I just came up with that idea of, let's not have in-person meetings when the weather's likely to be bad. And so that's how we came up with the dates that we floated past you all. It sounded like everybody was okay with that.
Maheen, will you send around the final
Yeah, I will.
schedule again? Thank you.
Thanks.
Oh, you're probably looking at me and I shouldn't be changing my calendar for October 9th. So moving to the director's update.
Yeah, I think we actually covered a lot of this stuff during the course of our conversation about work priorities for the board. But just to remind people that we are doing public health nursing drop-in hours once a week starting May. So Wednesday afternoons, Olivia has drop-in hours and then she does childhood vaccines later in that afternoon. So that will be great to offer that service to people. We're actually having a lot more people just kind of come in and want a blood pressure check or want to ask us about something. So we're feeling happy about that. We are going to be getting more COVID tests in. There's still an interest in having them. I think the levels are very, very low right now. Flu season is finally over. COVID levels are low, but in the past, there has been a summer surge, especially when it's been a low winter COVID season. So we're eyeing that. We're watching the wastewater carefully, and I think it may be helpful to have tests in stock if that happens. So we're hoping those will come in the next week or so. And then Maheen and I are working with other people, including John Snyder, Betsy, on a vaccine information campaign. We have kind of convened a group of people to come up with a slogan, and we're going to do a website. And so it's
Oh, that's great. And that's John's really good on that. He's loved this topic for ages.
Yeah, he's
Yeah.
amazing. He's a great resource and he's got the time, and it's just, and we have a good group. It's very exciting. So hopefully we'll have something this summer. Also, we'll have 2 interns to help work on that over the summer, and we'll get stuff out there. So that's exciting. I also just wanted to briefly mention the Wellness Learning Community, which is a joint effort between Public Health and the Senior Center. And now, since I'm in charge of both of those operations right now, I'm paying a lot more attention to this Wellness Learning Community and trying to have, it's a weekly thing on Tuesdays here at the Bangs on various topics, from stroke education to a watercolor workshop, like a watercolor / meditation workshop that we're doing, to the Amherst Police Department presenting on scams and how to protect yourself from scams, to a group of people who do hikes in the woods and write poetry and music about those hikes and show beautiful photographs of the hikes that they do. So we're just trying to bring a community of people together to learn cool stuff and connect with each other. It hasn't been that well attended. I think we need to do a better job kind of getting the word out about it, but been trying to work on that a little bit more. I mentioned the Red Cards campaign. We still have the Red Cards here. People are welcome to come pick them up so they can give them to folks out in the community. And then the last thing on my list was really to check in with Premila about the MAHB BOH certificate program that you went to last Saturday. And how was it?
Really interesting. It gave me a lot of background information, and they spoke about the legal authority, boards of health, which is pretty broad, as it turns out. And and then they talked about public records, open meeting law, conflict of interest, and then SAFE 2.0, which I wasn't aware of, and when we entered the space, it asked, "Are you part of the Public Health Excellence Grant?" And I didn't know. You've mentioned it before, now that I think about it, but I didn't come to me at the time. So anyway, so that, and then they also talked about liability protection for boards of health, and then there was also information about conducting quasi-administrative and quasi-judicial hearings, which there was a lot of overlap with the tobacco hearing, for instance. Yeah, so it was well worth attending for me. Very interesting.
Good.
You may know a lot of this information already, Kiko, so I'm not sure. how relevant it would be for you, but it was very interesting for me as a board member.
So you'd recommend it for other board members? Thought it, yeah. I hope they do it again, because the next one's in Marlboro, in 2 weeks' time, and that's a bit of a drive. So I don't know how, if they do it once a
Sounds
year.
like they do it annually.
Do they? Okay,
Yeah.
all right. Good, well, thanks for the report. Go ahead, Betsy.
One other question, just in terms of topics to put in that big bucket of things to think about, is the primary care shortage in our community? I mean, I don't know whether there's anything we can do about it, but
Yeah.
Is it just our community?
well, I think nationally, but I think it is very much a problem in our community.
And when you say our community, you don't mean just Amherst. It's Western Mass. It's definitely an issue in the region,
Yeah.
right?
Yeah. I mean, it's
And-
less so in pediatrics. I think there's, you know, there's some shortages, but I think for internal medicine and I have so many friends who have had one person after another, their PCP leave, and there's no one available to take them. And you know, I don't know whether just highlighting the issue and having it on our, you know, on our radar is something that's a problem in search of.
And Betsy, do you have any like insight on, is it because Western Mass, you know, might have lower, you know, salaries or something like that, or just?
So I actually have a train, some of my doctor friends have been sharing with me, which I could share with this group. But you know, part of it is just nationally, primary care is you know, is less popular than specialty care, and some of it has to do with the cost of education versus salary potential. But I think it's also that you know, working in an area in Western Mass is a little bit harder because there are fewer of the specialty resources than there are in, say, Boston or other places, so that the job is actually harder. And I think, boy, when I used to serve on some of the medical boards, there was a lot of like Medicare reimbursement is lower in Western Mass compared to the eastern part of the state. And there's a higher low income, you know, it's you know, it's the money that's available to fund primary care and the resources available for primary care to use to do its job, and the overall decline in primary care. I think all of those factors are kind of additive, and there probably are no easy solutions, but I think it's a real problem.
Why would Medicare reimbursement be
They have
lower? Isn't that set?
There's a factor that has to do with the cost of living in an area.
Okay.
But you know, the nursing salaries and
Mhm.
nursing shortages are an issue. So
Yeah. I agree. I think it's something to keep on our radar. It's a big problem. I don't know how the Board of Health could be involved with that, but just something to think about.
and Musante probably, I mean, I assume they're incredibly busy, but they probably have a role to play in being
You know, I can speak to that. I know that because they're struggling financially, they've had to make some staff cuts, which impact scheduling appointments for new patients and so on. I think that's taken a big hit and it's taking a lot longer. So I just, you know. it's not as straightforward as you would think.
Yeah. And I wouldn't think it's straightforward at all.
It's even more, it's even more complex. I mean, I just know that, you have to leave a phone message if you want to make a new patient appointment, and then they'll call you, probably not dissimilar to the way it is in other primary care offices, but they have fewer staff to deal with things now, so.
Yeah, nobody answers their phone anymore.
Anyway, that's it for me for my updates. Thank you.
Okay, then the next is topics not anticipated. Does anyone have any? Okay, and then if not, then it is time to adjourn. I think we need a motion.
So moved.
Mhm.
Seconded.
All right, all those in favor of adjournment? Thank you all. It was nice to brainstorm on these topics today. Appreciate it.
Yeah. Thanks,
Have a
everybody.
good evening.
Thanks, everyone.
Have a good
Bye-bye.
evening.
Bye-bye.
Bye.